Hi everybody, my name is Jacob Smith. I was last year's United2Heal president. I've been involved with the group since basically it got started a few years ago. And I'm going to be introducing our keynote speaker tonight. So our keynote founded an organization that collects surplus medical supplies and sends them to other countries in need of those medical supplies. I'm not talking about U2H, I'm actually talking about D2D, or doc to doc. So Dr. Bruce Charash graduated from Cornell University in 1981. He's practiced cardiology in New York for over 30 years. He is a clinical associate professor of medicine at NYU. So Dr. Charash founded Doc to Doc in 2006 after a direct challenge from President Bill Clinton. He was part of the original Clinton Global Initiative conference. He will be speaking a little bit more about that in his presentation. Very, very interesting story how that got going. But just so you know, they really do something very, the work is not only very similar, but actually the way that they go about it is very similar. Just to give you an idea, we do a whole bunch of work. We put together one container a year, which is awesome. It makes a big impact. In the last 4 years, Doc to Doc has actually sent 80 containers, 40-foot containers, to hospitals in need around the world. Just to give you an idea of the scope of their project, with accelerated growth, they're sending more and more containers each year, which again, I'm sure he'll speak a little bit more about. And they're working to nationalize this effort. They're working to get bigger. Just to give a quick personal note, I reached out to Dr. Charash originally when I found out about Doc to Doc. I was inspired by the fact that they were doing almost exactly what we were doing, but on a much larger scale. It really inspired me that this project could be done on a much larger scale. I sent him an email. He responded almost immediately, was extremely, extremely friendly. We set up a phone call and started talking. He's been extremely, extremely friendly from the get-go, happy to help us. He offered to fly out and speak like right away, like during our first conversation. So he's not only a friend of mine, but he's also, him and his organization, Doc to Doc, are an inspiration to this group and what we're trying to do. So before we get going with the speech, we're going to show a quick video that explains what, that's my adorable baby cousin, a quick video that explains a little bit more about what they do. Changing the name to United2Heal. So without further ado, I'd like to invite Dr. Bruce Charash to the stage.
Thank you, everyone. Thank you very much for that very gracious introduction, Jacob and Albert, and all the members of United2Heal, Dr. Anderson as the new faculty advisor. It is I who is honored to come here. For all of you, for the effort that you all put into this and that you care. I'm inspired by this university's effort. And it means a great deal to me because I think that we all have an obligation, a moral obligation to do the best we can to recalibrate conditions on this planet as best as possible, to try and help those people who are suffering and dying before their time. We're lucky to be in a country of enormous excess, and it's really, to a degree, sinful to let it go to waste when other people can live, just because they need what we have. And we're just sending the tools for the local medical community to do their job. There are very well-trained and very talented people in most of the developing nations I've been to, and Ghana is potentially my favorite country. I shouldn't say that, but don't let the other countries know that we work in. But I have a real passion for Ghana, and I've met healthcare providers there that show enormous dignity, quality, and enthusiasm that they need tools. And it's very difficult to practice medicine as a clinical cardiologist and Dr. Anderson as a clinical obstetrician. If you don't have the tools and you stand around a bunch, you will die because you don't have any of the equipment or consumable supplies that you need. It's a frustrating and difficult phenomenon. So I'm going to, first of all, the students, or anyone really, how many of you have gone to a developing country and seen extreme poverty conditions, extreme poverty? Okay. Now, I met some of the students here who have not, and obviously it costs money to go. You have to have an opportunity to go. And when you do go, and I think most of you are motivated, you want to go, you'll see what's a difficult emotional substrate, I think, seeing the dehumanizing and horrifying conditions of extreme poverty. And then in contrast, you see the dignity and the generosity of so many people who are living in such difficult conditions. And it's a very difficult conflict of emotions to see that grace, to have people offer you things, and to see the conditions that you're going to get on an airplane to fly home, where on the continent, 1 million people will die of malaria, and you can take them out and be relatively safe. I think it just highlights the fact that we all inhabit this planet, and even though there's a lot of differences between us genetically, we're 98 or 99% the same. So anyway, I'm going to just talk a little bit about Dr. Doc. And it's always good to show cute children pictures. This was a child. We sent a series of containers to Haiti right after the earthquake, and this was in March of last year, so it was within 6 weeks of the earthquake. We flew down to make sure some medications and supplies got to a pediatric hospital. This child was orphaned by the earthquake, but I don't know if you can notice he has a tear going down his right eye. That's visible. He was in an orphanage, and he started to cry when we were leaving because we were paying attention to him, and then when we turned around, he put up a smile. So he was kind of like the people of Haiti with both kind of tears and smiles. This is a young girl in Accra at a school clinic. We built, with a friend of ours in New York, a clinic in this school that provides health care to both the children and the parents because they're so great in need. This was in Kofunachi. This was a child up in Kumasi. And I'm always struck by, we dress down to go to theater, and you see some people wearing dresses in the hospital to show you kind of their pride about who they are. That was good. Okay. So every day in the United States, we throw out and send to a landfill about 7,000 tons of medical supplies, which are either unused or reusable. No, 7,000 tons a day. I was telling some of the members of the executive board of United2Heal that last time we had dinner, and I was pointing out that I got this number when I was starting Dr. Doc from a publication, and the CBS Evening News ran a small piece about us. And their chief medical correspondent, John LePook, wanted to use the number himself. He wanted to be able to say it. If I'm interviewed on TV and I say the number, that's one thing. But if they're going to say they need it fact-checked and they need the source. So they called me up a few weeks after they interviewed me and said, can you please provide us the source by which you say that 7,000 tons of medical supplies are thrown out a day of totally good stuff? I said, sure, I found this once. I'm going to find it again. It's been a few years. So I Google searched it, and I put in quotes, 7,000 tons a day. I figured that would be the way to find it. And 38 references came out, and I started opening each one up consecutively, and they were all me saying it. I got a little nervous, and I wondered, is this like in principal office kind of trouble? I mean, what happens? I eventually found the source, but it just shows you the power of creating your own facts, as we know some semi-news organizations do. You just put it on the internet, and you can say, I saw it on the internet. It must be true because I said it. Okay. Same time, obviously, developing country, thousands, tens of thousands of people turned around each day for lack of these same supplies. And even in Ghana, in countries that are much worse shape, like Sierra Leone or the Congo, if a family member needs emergency surgery from an accident, appendicitis, there are many areas where they'll say, fine, you can go have the surgery, but here's what you need to bring back to the hospital for us to do it. You must go home. You must come back and bring us 8 pairs of surgical gloves, sutures. It's a Kafka-esque type of experience where you don't have any money and they don't have supplies, and they're telling you to get the supplies where there's nowhere to get it, and if it was there, you couldn't afford it. And that's because it's expensive to get these supplies. Many of the ministries of health, like in Rwanda, have a $10 per person a year budget. And the focus